Hi, I'm Dr. Chuck. Welcome to Your Filthy Mouth. Today we're going to be talking about things that can be going on inside of your mouth that you have no idea. Stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, I'm Suzanne Lynn, and I'm here with Dr. Chuck to talk about your filthy mouth, specifically how it holds the key to what's happening in the rest of your body. Today's topic is going to be about what's happening in your mouth that you don't even know is going on. But before we get into that, let's ask you to subscribe, whether you're watching on YouTube, if you're listening on a podcast channel, just go ahead and hit the subscribe because we don't want you to miss one single show. And we appreciate it. It means a lot to us. So, Dr. Chuck, going to be honest with you right off the bat, been fighting the flu. I think I'm on the better side of it, and I hope I'm not contagious.
Well, I'll stay back just a little bit.
Okay, it sounds good. I guess we'll know next week whether I was contagious or not, right?
We'll find out.
So this week we're going to be talking about what's happening in your mouth that we don't even know about. And to me, the mouth is for tasting food. What else could be going on?
Well, the mouth is for a lot of different things. But one of the biggest challenges we have is that so many diseases can be going on inside the mouth without any symptoms. You have no idea what's going on. You have absolutely no pain. The older I get, the more I like pain. I never want to cause pain. Pain is a wonderful motivator. Lack of pain doesn't motivate.
So things that are happening in your mouth that we don't know about, what is the first point?
Well, you can have cavities. Let's start with the simple things. If you don't get the plaque off the teeth, the plaque is going to deposit acid. You're going to get cavities on your teeth. Okay. The cavities can work their way into the tooth, give you an abscess. That abscess goes out the tip of the tooth, and you'd think that all of these abscesses are going to have pain. Many of them have zero pain.
Like what percentage would you say?
Oh, I'm going to say about 60% of,
wow, more than half don't.
Have no pain. Now we're about tooth infections. When we get to the gums, it's closer to 90%. Have almost 100% of gum infections have no pain.
Wow.
It's going on for years, decades, no pain going on.
Crazy.
So in your mind, you think everything is fine.
All right, so the first thing going on, cavities, things you don't even know about with your teeth.
Yeah. And then you go to gum disease. So you've got the teeth, the gums, the bone, and then the airway going on there. Well, on the gums, according to the Center for Disease Control, over 70% of the population that's over 65 years old has periodontal disease. That's not just an inflammation of the gums, but all the way into the bone under the gums. That's 70%. 7 out of 10 adults over 65 have this going on, and there's no pain.
So what's the big deal?
Well, all infections, I don't care where they are in your body, whether they're in your hand, your foot, your mouth, all infections produce pus. What is pus? It's a yucky stuff, that white stuff. Okay, well, pus is made up of harmful bacteria, dead tissue debris, dead white blood cells, inflammatory proteins, and some other toxins. Not good stuff.
That doesn't sound like something you definitely want in your mouth.
Well, when you have a wound and you see you got pus coming out, you clean that up.
Right, absolutely,
because
it can get worse, and you hear about people losing limbs because of that.
Of infection going on.
Right.
When you pop a pimple, just a simple thing, that's pus.
Don't want it in the mouth. No.
Well, if you have it in the mouth, it either drains out or it drains in. And sometimes it drains out, and people can say it tastes kind of like a copper penny or metallic taste in there. Yeah. That's the pus draining into your mouth. If you don't taste it, many times that pus drains into your bloodstream. Now, this can go on not just for days or weeks, but literally for decades with no pain.
So what happens? So you've got infection that you can't see, you don't feel, and it's going through your bloodstream. What does that mean?
Well, you don't have to have MD after your name to wonder, is it okay, is it healthy to have pus running through my arteries, through my bloodstream? The answer is no, it's not okay.
Right.
So what they've already proven that the bacteria in periodontal disease or gum disease, this is a huge word, are causative, that's a big word, causative for cardiovascular disease. Well, what do you call the stuff that builds up in your teeth?
That's plaque.
What do you call the stuff that builds in your arteries?
Plaque, and that causes heart attacks.
Okay, so they've shown that 50% of heart attacks are triggered by oral infections, dental infections. And if 90% of these infections have no pain, we have a problem here. We need to identify these infections that are going on that are symptom-free.
Okay, what's the next point?
Okay, what about the bone?
Okay.
So we've got the teeth, the gums, and then the bone. When you look at an x-ray, many times you can see where the bone is lost. You got it lost from two things. Number one, from a tooth infection where it's destroyed the bone around the tip of a tooth, or from a gum infection where it's destroying the bone. I look at a tooth as a fence post in the ground. If you've got half of the fence post in the ground, that's pretty solid. But if you take the garden hose and you wash around that fence post, eventually you're going to wash the dirt away,
Right.
and that post's going to fall over. Well, in the mouth, it's the same thing, except for you don't have a hose in there. You've got bacteria and plaque, and you don't have dirt, you have bone. And as the bacteria are going around that tooth, dumping their byproducts, it sets up a reaction from the body, which destroys the bone. So now the bone goes down around the teeth.
Wow.
And it looks like a boat dock at low tide. I mean, pretty
Right.
soon there's no bone around
After
that.
years of bacteria, that's what's going to happen.
And where has this bone gone? Where has the infection gone? It's all been absorbed into the bloodstream. Is that healthy? No, it's not. It's not. So the thing we're trying to help people connect is that just because something doesn't hurt doesn't mean there's everything okay. So we talked about the teeth, we talked about the gums, we talked about the bone, now the airway. Okay? Are you breathing good at night? We're talking about the mouth now. Many people have huge tonsils. They've got a big old thick tongue. Maybe they had teeth taken out for orthodontics years ago, so the jaw is a little bit smaller, but the tongue didn't get any smaller. So that tongue is squeezed into a smaller space. Many people are having some type of sleep disordered breathing because of things going on inside the mouth. If you're not getting a good night's sleep, you can have elevated blood pressure. Of course, you can snore.
Right.
That's a simple one. But you can have elevated blood pressure. You can be sleepy during the day. There's a lot of other things. But that's the mouth. And this is how it can be affecting you, and you have no idea what's going on.
So you go, okay, I'm not sleeping well at night. I need to talk to my dentist. That just doesn't happen.
Well, that's
it
what
should.
and there are sleep physicians. And you need to find out, do I have some type of sleep disordered breathing or don't I? And sometimes the best one to ask is a bed partner. Hey, he snores a bunch and I got to nudge him a few times to get him to breathe. That's a red flag right there. So, but that's the mouth, and it's symptom free.
A lot of stuff going on we don't know about in there, right? All right, well, hang on. We're going to be back with the question of the week.
Here's Dr. Chuck's question of the week.
Hey, Dr. Chuck, I'm Amanda, and I just wanted to know, do dental shots and other mouth work have to hurt? I can always count on having pain when I go to the dentist.
Hey, Amanda, that's a great question. It doesn't have to hurt. It really shouldn't hurt. This is, right now, this is 2019, not 1919. Back then, they had, I think, square needles. It's come a long, long, long way. We've got topical anesthetics. We've got smaller needles. We've got fantastic anesthetics for getting you numb. The main thing you want to do is make sure you find a dentist who's not into pain. Some dentists are a little bit more cautious than others when it comes to injections. I like topical anesthetic. Put it on there. Let it get the gum numb before you do the injection. I like to wiggle the tissues around. That can confuse the brain a little bit. In other words, there are some tricks that you can do to make your visit more comfortable. Make sure you're going to a dentist that knows some of these tricks, because dentistry shouldn't have to hurt in 2019. It really shouldn't. Now, if you have a problem before you get to the dentist, yeah, you're in pain before you walk through the door. So we got to get that infection under control, take care of that problem, whatever it is. But as far as your routine dental care, should not be any discomfort. Yeah, you're going to hold your mouth open. You may have a little bit of tenderness after you did have an injection, but as far as any kind of a toothache or bad experience, this is 2019. We shouldn't have those.
Okay, so this week we've been talking about what's happening in your mouth that you might not even be aware of. So let's talk about the takeaways for this week, Dr. Chuck.
Well, there's 4 areas you need to be concerned with that may not have any discomfort at all. Number 1, that's your teeth. Number 2, your gums. Number 3, the bone underneath that. And number 4, your airway. So those are 4 areas that might not have any discomfort, but can be greatly affecting your overall health.
So getting to a dentist for sure.
Yeah. Getting a proper exam from a qualified dentist, absolutely important. If you're going to work on a car, you got to look under the hood.
Right.
Get your engine checked.
And maybe you're not experiencing any problems with your teeth. Maybe you're loyal to going, twice a year, but maybe you've got friends or family, maybe your kids. You've thought, well, they're too young to get them started, but it's important that they know.
Absolutely.
Share this information, right?
And this is what we're asking you to do, is to share this information with your family, with your friends. We're not trying to do more dentistry. Actually, I'm doing just the opposite.
Right.
I'm trying to do everything that we can to help you keep your mouth as clean as you can so you have less dental care that needs to be done. And also, in the long term, that'll be less medical care. So that's what we're looking for, is let's spread the word. It's common sense, and common sense is so uncommon.
Well, maybe you've got a question for Dr. Chuck. Just go to yourfilthymouth.com and you can just press the button on the computer and speak the question into it or write to us. And if you go to yourfilthymouth.com, you're going to see all kinds of dental hygiene items that is approved by Dr. Chuck. So check it out. Lots of show notes and everything there as well. And don't forget to subscribe because we don't want you to miss any shows, whether you're watching on YouTube or one of the podcast channels.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.